On a press release dated 29th July this year, the Sierra Leone Medical and Dental Association denied claim allegedly on social media that the association came to terms with government on the concerns of salary and the weekly 45 liters of fuel for doctors that triggered the ongoing strike action by some health workers. In response to the action, the minister explains what led to the removal of the allowance.
Over the past few months, as you could see, the numbers of COVID have dropped precipitously. There hasn't been any excess hospitalization in the whole country. There hasn't been any excess diagnosis in the whole country. So the risk hasn't disappeared yet, but the threat has gone down considerably. And so what we're doing is a shift now from this generic allocation of allowances to everybody to get much more targeted allowances for those that are doing vaccination, which is really critical to our work, and for those who are actively involved in surveillance and those who are actively involved in lab testing. So that's where the focus is. The government thought that, well, no matter what happens, the health sector, they might be still involved in these processes. So even when they dropped the military, they dropped the police, they dropped everybody else, they kept the Ministry of Health for a while longer. But lately, because of the very, very tight fiscal space in which Sierra Leone is and all of the world is, especially in West Africa, you saw that in Ghana, they just dropped everybody's salary by 30%. It was asked by the development partners that if you want budget support for all of the running of the government or the country, you have to make some tough choices. It doesn't look right for you to be paying allowances for COVID risk when the risk is so low in the country. So the government stopped the allowances by the end of May. The sad thing about it, though, was it was such an abrupt stop. They didn't inform the Ministry of Health staff that they were going to remove these allowances. And so it was quite a bit of a shock.
The health minister seems puzzled about the strike action by doctors when efforts are in progress to respond to the demands.
What we have here is a letter from the Ministry of Finance that's authorizing two things. First, all of those that were impacted by the removal of allowances, COVID allowances from their compensation, they want to reinstate all of those costs as a salary increase starting in September. And the government, to kickstart that process, has set aside about 20.85 billion leones to get that going. At the same time, for the second request that the doctors had about their fuel subsidies, which is an entitlement for them, but the funding is not fungible. You can't use it for anything else, but specifically for the fuel for the doctors. So here also the Minister of Finance has said they've set aside extra budgetary 9.3 million leones, which is the equivalent of 9.3 billion of the old leones. And again, they've asked us to start the paperwork for it. We're ready, the paperwork is all being prepared. As soon as we get word from the doctors, we'll be able to move this forward. The really important thing about this, the fuel is not just for doctors, it's for all senior level people with grade 9 and above. And it turns out all of the doctors enter the service at a grade 9, so they're eligible. On the salary supplement, it's not just the doctors, all of the nurses, all of the technicians, everybody in the health sector that was responding to COVID that received allowances, we're going to replace that come September.
The health minister calls on doctors to go back to work and do it for the sake of patients like this kid who is being attended to right now. Salif Cherno Kamara, AYV News in Freetown.